country and our state are facing historic financial challenges and economic challenges. That's going to require difficult decisions be made by policymakers across the country and certainly here in Minnesota as well. Families across Minnesota are tightening their belts. Businesses across Minnesota are tightening their belts, and they expect government to do the same. And we intend to make sure that that happens, and the first step in that regard is the unallotment decisions that we're announcing today. As we go through these unallotments, you'll see that our priorities that we tried to protect are not affected by these unallotments. And as I mentioned in a previous press conference, from my standpoint, we want to do all that we can to protect the priority areas of military and veterans programs. We want to protect public safety programs. We want to protect K-12 programs and as many others as possible. But clearly some are impacted by these allotments, and I'll go through those with you now. The deficit for the current biennium has to be resolved. Unlike the federal government, the state of Minnesota cannot deficit spend. We cannot print monopoly money in the basement. The books have to balance, and that's a constitutional requirement. And so when any deficit opens up in Minnesota's finances, it needs to be addressed promptly and directly and aggressively, and that's what these unallotments do. The deficit, as a result of the November forecast for the budget cycle that we're in right now, which ends next summer, was $426 million. As part of today's announcement, I'm formally directing the Commissioner of Finance to use $155 million remaining in the state budget reserve, which leaves $271 million to be solved as part of this unallotment process. I'll just go through the highlights following along. You'll have the press release as a guide as we go through this discussion. The 271 is met by the following unallotments. First, $66 million reduction in aids and credits to cities. Second, $44 million reduction in aids and credits to counties. Third, $73 million reduction in human service spending. Fourth, a $40 million reduction in appropriations to the University of Minnesota and the corollary organization, the Minnesota State College and Universities. Next, a $40 million reduction in state agencies and state government. Next, a $4 million unspent balance from the Minnesota Housing Finance Agency. A $2.2 million voluntary reduction that we requested from the legislature. A $1.5 million reduction from the 21st Century Mineral Fund, and $700,000 from the Minnesota Investment Fund. I'll go through these in more detail now. First, as it relates to aids and credits, I think most of you in the room know that there's a large twice-a-year payment that goes out to local units of government. The payment that was scheduled to go out in just a few days was $473 million. After this unallotment, there's still a gigantic payment going out to local governments, and that's $363 million will still go out the door next week. As to county aid, we're reducing that by $44 million. That is a 1.68% reduction in the amount of aid and levy that counties have available to them on an annual basis, 1.68%. We also made the decision to exempt counties of less than 5,000 in population, and you'll see we did the same thing for cities under 1,000. The concept being that smaller organizations in that regard have fewer options, fewer economies of scale, fewer choices in terms of dealing with this reduction. But this will be, on an annual basis, a very small percent of aid to counties that's being reduced. We had a very constructive meeting with the leadership of the counties. The legislative leaders and I met with them just a few days ago. Obviously, they didn't want to see any reduction, but I believe that they will find this range of reduction manageable under the crisis circumstances that we find. It's also a modest percent of their, again, annual operating budgets, less than 2%, and with the exemption that will help the small counties as well. City aid is being reduced by $66 million. That's an average statewide reduction of their aid plus levy on an annualized basis of about 3%, 3.03%. No city on the high side will experience more than a 4.08% reduction in their annual aid plus levy. And then we also added this. Cities of under 1,000 people will be completely exempt from these reductions. So of the 854 cities in Minnesota, 505 of them will be exempt, almost 60% of the cities. And we also had a very good meeting with the leaders of the League of Minnesota Cities. They brought forward a number of good suggestions. One of the concerns, certainly not the only concern, was the disproportionate impact that small cities face when they have reductions like this, again, because of the lack of economies of scale. And so we're trying to do our best to accommodate that by exempting 60% of the cities from this reduction. I also want to suggest that the discussion that we had with the cities and the counties focused on reforms and changes going forward for 10 and 11. Both offered good ideas. The counties have a blueprint for redesigning the relationship between the state and the counties on a whole variety of matters. It's a wonderful piece of work. We're going to be inviting them to our Reform and Idea Summit on January 5th, and we're going to continue to meet with them. So as we go forward into the 10 and 11, the next budget cycle, that we incorporate as many of the county's ideas and the city's ideas into reforming that relationship and improving that relationship as possible. And they got a number of really good ideas that they've offered up, so that was a constructive note. I might just say a word also about, you may hear today from some that these are cuts in local aids are less than they expected, and we've heard from people already that they were thinking of a worst case scenario in terms of impacts on cities and counties. But you may also hear some voices expressing concern, and we understand that and want to be respectful of those concerns. But to the extent somebody suggests that this is going to cause them to reduce or lay off public safety as a first reaction, I would take issue with that, respectfully disagree with that. There are lots of options, not in all cities, but in many cities, where they can go to reduce spending or to tighten their belts before they might impact police and fire. Any city council member, any mayor, any city administrator that says their first course of action is going to be affect public safety, I would politely suggest to them that they have misplaced priorities. And I won't name names, but I'll say, for example, if you have a city who is funding a cultural affairs department with staff and they don't affect that before they consider public safety, I would say that's misplaced priorities. If you have a city that has an Office of Environmental Sustainability that overlaps dramatically with many of the state programs and regional programs, I would say you should look at that type of program before public safety. If you have cities that are running their own human rights department, and human rights are extremely important, we want to make sure that we vigorously enforce them and monitor them. But keep in mind the federal government has a human rights enforcement function. Keep in mind the state of Minnesota has a statewide, robust human rights department. Keep in mind individuals can bring private rights of action to enforce human rights. And so a city who would be creating a department like that or having a department like that that overlaps dramatically, if not entirely, with the jurisdiction of an agency that already exists at the federal level, already exists at the state level, and also overlaps with the private right of action that individuals can bring on their own behalf, that's an area where they may want to think about scaling back before they come and talk about their decision or discussions to affect public safety, and on down the list. So I know that those comments will come, but I want to make sure that you had the benefit of our perspective on that as you receive and hear those comments. Next is the human service area, is a reduction of $73 million. You've heard me say many times that both the federal government and the state government are, the trajectory of increased spending in the human service area is unsustainable. It's mathematically unsustainable in the intermediate and long term. We had in mind a reduction in some of the eligibility for programs that stand out as being unique to Minnesota, way above the national average, in fact, only exist in Minnesota. But in consulting with a number of legislators, particularly a number of legislators in the Senate, we got some good ideas around reducing some areas of operation that don't affect eligibility for health care. It's not to say that those issues won't be joined next year when we tackle the larger budget problem, but rather than taking down some or all of a program like that, we have found a number of operational areas that have excess funds, unused funds, and affect institutions rather than people's eligibility directly. And they are these. First, the MERC fund, the Medical Education and Research account. Now, this is an important and good account, but this is only part of the payment that they receive in a year. It's a $51 million a year. This is a reduction of $28 million. The impact on that will be on institutions and hospitals and others who train medical professionals. Number two is a $10 million reduction, which represents an add-on payment to base rates, reimbursements to medical providers who treat medical assistance patients. Again, this does not remove or reduce the base rate payments. It only reduces the a portion of the add-on payments for those services. And then a series of unexpended funds. I'll go through them quickly. First is a $17 million reduction in a consolidated chemical dependency treatment fund balance. This is a good program, and these are needed services. However, the amount of money under the November forecast that's needed to serve in this program is exceeded by the money that's been, that's been appropriated exceeds the projected need. So we have a $17 million projected overage or excess in the program, and so we are reducing the program by that amount. They otherwise would not have been used during this fiscal year and canceled back. Next is $2 million in new mental health grants. We have, over the years, along with the legislature, created a very large new initiative around mental health reform and improvement. It's a good initiative and I think a needed set of reforms and improvement, but for other reasons unrelated to the deficit, there was a start in the delay of the issuance of these grants and the purposes of these grants, so they weren't going to be used in all likelihood in this fiscal year and canceled back, and so we took $2 million of what would be those grants unused. Similarly, the next item is a $6 million in mental health grants. This is a payment under the current law that can be made in the next fiscal year. The next one is $98,000 in community service development grants. These are primarily used for capital improvements for nonprofits for their buildings and structures. This amount has not been awarded, nor are there any applications pending to use that amount of money. Next is $2.7 million growth in medical assistant waiver programs. This is a valuable and needed and good program, but it's been growing very fast, and so we are capping or limiting the growth in the program to a more modest level, which will allow a $2.7 million reduction. The next item, $250,000, is the housing grants related to the slowing down or capping of that previously mentioned program that I just went through. The next is $6 million in adoption assistance. Again, a very valuable program, but under the November forecast, this is a monies of appropriation that exceed the monies that would have been used by $6 million, and so the funds would have not been used and canceled back to the general fund, so we pick up $6 million there. $491,000 from the patient incentive grants. This is a program that is not yet fully developed. It hasn't been using the money or utilizing the results that we'd like just yet, and so we think we can take $491,000 out of that. Similarly, the next item is an outreach bonus payment. It pays $25 per person that an institution will enroll in publicly subsidized programs, but the program is moving more slowly than we would have hoped or projected, so we can take $200,000 out of that. MnSCU and the U, $20 million each. I will note that in each case they have substantial reserves. And by the way, jumping back to cities and counties, many of them have some reserves as well that far exceed the amount of cut that they'd be taking in local government aid. But as to MnSCU, if you include their central office monies, they have about $77 million in reserves. The U has $15 million in reserves plus at least $50 million in monies that are not currently obligated in state appropriation money covering, doesn't cover anything relating to binding obligations currently. Next is a 10% reduction in state agencies totaling $42 million. The details of those are due from our agencies by January 1st. We'll formally unallot those in early January. Minnesota Housing Finance Agency has a trust fund. It's got a $17 million balance. We're taking $4 million out of that, leaving $13.7 million for remaining projects. 21st Century Mineral Fund, which is a economic development fund for the Iron Range area. It's been used well for projects, and we've always said we'll make sure we fund those projects, but this is money that is not dedicated to any particular project, so it's $1.5 million that is available for that fund without jeopardizing any commitments to existing projects. And then we also have the Minnesota Investment Fund, which is over at the Department of Economic Development. It was set up for some biomass grants, but nobody has applied and the money hasn't been expended, so we're unallotting that $700,000. That should all add up to $271 million. We're going to transmit the communication to legislative leaders this afternoon, and the unallotment will take place shortly thereafter. With that, I'll be happy to take your questions. No. There's a little bit of paperwork that has to be done. Some of them will take effect very quickly. Others, like the state agency cuts, will take effect in January, Pat. Others, will just be effective in the next few days or week.
Taken as a package, how would you estimate its impact on people's lives in this?
Well, we're not choosing between good options, so we're making very tough decisions, but it's necessary, and it's no different than, again, what families are going through as they reset their priorities, reset their budgets, or businesses are going through. They expect the same from state government. This set of reductions, I think, we've tried to do our best to avoid things that directly impact direct services, particularly in the human service area, for the reasons I outlined in my comments. And I think in the area of local government aids and credits, in light of the smaller percentage than I think many cities and counties were expecting, they should be able to manage that. I mean, it's just a few percent of their annual budget. And again, many of them have reserves, and we've exempted the small ones. Again, it's not ideal or positive, Eric, but I think in the context of the crisis that we're facing, we tried to make those unallotments or decisions that would be least harmful or least impactful to people.
Senator, I have a feeling Minneapolis and St. Paul may feel a bit picked on. Just proportionately, they do end up with the largest dollar amount cut for the cities. And then also you mentioned cities who have departments like human rights. Minneapolis and St. Paul both have their own departments of human rights. And even the state's own website directs people to Minneapolis and St. Paul's Department of Human Rights. We're talking about cutting it. Is it fair for the state to be directing people to those city departments?
No, what I was trying to address, Mary, is it's whenever there's cuts at the federal level, they say they're going to shut down the Washington Monument or, Mount Rushmore or something. And so the first thing some city officials do, they say we have no choice but to reduce police and fire. And I'm just making the point that's not true. At least in my view, it reflects misplaced priorities. And they use it as a way to kind of stir up emotions. But before they start talking about police and fire, one thing they might want to consider is some of those other programs that, in my view, have a lesser priority and overlap and are duplicative of existing services that are available at the state and federal level. I would also note that many of these cities, and again, not to pick on anybody in particular, but this is a positive comment, Minneapolis has a $50 million reserve, $50 million, as reported in the newspaper the other day, and I think verified otherwise.